Welcome back to another episode of Dentistry's Growing with Grace podcast. Join Grace and her guest of the week as they discuss lessons learned in the industry and explore unique insights into ethical growth.
Hello and welcome to Dentistry's Growing with Grace. Today I'm so excited to have Dr. Eric Black with me here today. How are you, Eric?
I'm great. Thanks for having me.
Thanks for being here. Every time I talk to you, I'm always just astounded. Like, how are you so relaxed? And how are you even available to do this podcast right now when you have so much going on? You've got your Facebook group, right? What's the name of that?
Yeah, so I have a couple of them. One is Deals for Dentist, and then the other is the Stress-Free Dentist.
Awesome. And you are writing a book.
Mm-hmm. Yep, that's going to be coming out in a couple of weeks, actually.
Awesome. You are now speaking, and you're a life coach, and you're a dad and a husband, and you're all of these things, and a full-time practicing dentist.
Yep.
So I'm just always astonished, like, how in the world do you find time to do all these things?
Well, I have little kids, so they're 6 and 8, and I get up really early, and I'm up at 4 a.m. and I'm working on my website or preparing for a podcast or checking my emails. And then they get up and either I'm heading off to the office to work. I work 4 days a week in the office, or I'm dropping them off at school. And then when I get home, I'm doing some things or picking them up, or I'm coaching soccer in the afternoon. But I always find a little time here and there just to get things done. And I find that I have to do, like, if someone sends me an email, I feel like I have to answer it right away, because otherwise it could get lost in the shuffle and I'll forget about it. But also at the office, I do a lot of these things in between patients. So I do them in the gaps in my schedule. And I find it such a great distraction to have all these other things going on than just the dental office. And, even now I find that if a patient cancels, whereas, years ago I would have been all upset, or what happened to that patient? Let's try to squeeze someone in. If a patient cancels, I'm like, cool, I'll just work on something else. So it all works. I squeeze it all in. So,
you're
not much.
Organized and very productive.
Yeah. I try to be.
Awesome. So, tell me a little bit about just your journey. Like, how did you come to be a dentist? And then what kind of led you into some of these other businesses that you're now venturing into?
So I grew up in Massachusetts, and I live and work here. And my dad was a dentist, so I was always around it. But I actually went to Tulane and down in New Orleans and didn't want to do dentistry. I was going to apply to the business school and plan on being a business major. And then I took microeconomics and macroeconomics and statistics, and I'm like, this isn't for me. And I started to look into other health professions, like being a physical therapist, a physician, maybe dentistry. And then one night I was at a bar, which college students tend to do, and I just missed my mouth. I had a beer bottle and I cracked my front tooth, and I walked around that night with half a tooth, and I was intoxicated, so I didn't feel any pain. And my friends like scrambled around to get the piece of tooth, and they, just to mess with me, one of them kept it in his wallet all semester. But the next day I went to a local dentist in Metairie, Louisiana. And I just really liked the way they just took care of me and patched me up. And I walked in there with, I didn't want to smile, and I walked out of there and I was smiling again. And I just really liked the way the service, the way they took care of me. So that got me thinking to actually pursue dentistry. And I started to hang around my dad's office more. And at the time, Tulane didn't have a pre-dental or pre-medical major, so I chose psychology as a major. But I took all the prereq classes on the side. So like the physics, organic chemistry, general chemistry, biology. I did those over the summer. And then actually a year after Tulane, I took a year off just to focus on those classes, the DAT dental exam. And then I taught tennis for a year. That was my thing. And then I ended up getting into Nova Southeastern down in Fort Lauderdale. And that's where I went to dental school. And then I did a residency at BU, and that's what brought me back to Boston. And I've been here ever since.
That's awesome. I too cracked a tooth with a beer bottle. We have that in common. I did it only a few years ago, though, at the Chicago Midwinter, and I cracked 2 veneers. And it was a dental person who elbowed my beer bottle, and I was like, oh, I just felt my little teeth crumble in my hand, and I was like, oh no, you dental people.
Yeah, not a good night when that happens.
No, and I left it for a long time, actually, because I dreaded getting the front tooth repaired, because I was like, what are the odds that anyone's going to be able to match this? Like, this is going to be so challenging. But my dentist did a great job, but I still have no desire to be a dentist. So that's where we part ways there. Okay. So take me through, you get through dental school, or maybe you want to talk a little bit about dental school, but take me through kind of what transpired after you got into dental school.
So after dental school and after my residency at BU, I got a job and actually a few jobs as an associate dentist. And I worked in some, really great situations and some really awful situations. And I associated for a very long time. Actually, I felt too long. I associated for about 12 years because I just got comfortable in the situation where I could just go to work, do my thing, and then leave. And I didn't have to worry about the business side of the profession. And I finally made the plunge and partnered up at the office that I'm in now, and that I've been associating in since I graduated. And I really wish that I had made the plunge earlier to become an owner, but I was just comfortable. And I don't think I was necessarily mature enough at that point to become an owner and a leader. So I felt like I was going to do it at some point, but I waited a really long time. 12 years, I feel like is too long, and I wish I had done it sooner.
Yeah. Well, that's good advice. I always tell people, I'm super biased. I started my business when I was 24. And I always tell people, the sooner you can be an owner, if you have the aspiration to be an owner, the sooner you can be an owner, the better. But I was definitely not ready when I did it. But I learned. You learn, like trial by fire. Just jump right in and make all the mistakes. And but yeah, so what kind of pushed you over the edge to becoming an owner? What was the thing that happened where you're like, okay, this just makes sense?
Yeah, I just I wouldn't say mastered my clinical skills, but I had felt comfortable enough with my clinical skills, my patient skills, and I was ready. At first, we had some negotiations to partner up, and that actually was a very stressful process. The whole transition, working between lawyers, and that took way too long. That was almost a year-long process, and was very stressful because my partner and I were negotiating, but also working side by side and working in the same office. So there was a lot of tension there. I just knew it was time for me to either partner where I was or leave and do my own thing and start up my own practice or buy out another practice. I was just ready. And I ended up staying in the practice where I am. I'm glad I did. But I came out of there like a bat out of hell, like a rocket. And I wanted to do all of these changes immediately because I had been an associate for so long, and I had listened to all these podcasts, went to all these conferences, and spoken to so many people of different ways that I felt like I could improve the office. And I didn't really explain the why I was going to do these things. I just said, okay, I'm the boss now, and you're all my employees, and you just need to do what I say because I'm the boss. And that was not the right way to go about it. So, you do, like you said, you learn very quickly how to become a leader or how not to become a poor leader. And
You can't really learn it until you're in the role. You
right.
think you see like the leaders that you've had, you see the business owners that you've had, the managers you've had, and you're not going to do it like them, right? Because in your mind you have all the ideals and you think you can do it better than them, or at least I did. And then you get into it, and I'm like 11 years into business ownership, and I'm going, oh, now I get it. Now I get why he did this thing or said that thing or felt that frustration or had that stress.
Yeah.
Like, I want to write a handwritten letter to anyone who ever managed me and be like, sorry, I didn't understand. But you get this different perspective on things. And through those difficult mistakes, we learn how to be really great leaders, if we're open to that. So you mentioned stress. Talk me through your experience with stress and with burnout, and kind of how that creeps in as to your ownership role.
Yeah, I felt stress throughout every phase of my career. I felt stress applying to school, making the decision to apply to school. Actually, once I got to school, obviously the 4 years of dental school was extremely stressful. Then what do I do after I graduate was stressful. Actually, I think the least stressful years were while I was in my post-grad residency, but then I had to find a job, and I found several jobs. Some of them were not great situations as associateships, and those were very stressful. And, as an associate, it's nice, you go to the office, you do your thing and you leave, but you're playing under someone else's rules, someone else's staff, someone else's culture, their equipment. So you don't really have much control over the schedule or if there's staff issues or patient issues. So that can create a lot of stress as well. But then the transition to become an owner, that, like I said, that took a very long time and was stressful. But the granddaddy of them all is becoming an owner, because awesome, it's your business, your staff, your rules. But the bad news is it's your business, your staff, your rules. And you have to look at yourself in the mirror and ask yourself, are you being a good leader? Are you explaining the why? Are you getting the staff on board? And I didn't do that well enough. And I got an extreme amount of pushback from the staff. And I really started to regret my buy-in. I started to regret dentistry. I was, and this actually took years, but I think becoming an owner really pushed me over the edge. But for years, I had developed stress, anxiety at work. I was always afraid of getting sued. I was just nervous all the time. I was afraid of getting bad reviews. And a lot of this was because of up here in my own noggin. I'm an introvert and a people pleaser. So as an introvert and dentistry is a very social profession. You have to go from room to room and always be on, from patient to patient. That was exhausting for me. And I was a people pleaser. I never said no to anyone because I didn't want to disappoint anyone. I wanted everyone to like me and think I was the cool, laid back guy. So I was saying no to myself and I was saying yes to everyone else. And it came to the point where I just felt like I was being suffocated in the office. And when I finally left the office, I could breathe. And sometimes that was just even making it to lunch. I would cruise on home and go home for lunch. And then I'd be working through the week just to get to the weekend. And I was avoiding office functions. I was avoiding patients. I didn't want to do certain procedures. I was just nervous. And I just told myself after a while that this is no way to live. And I looked at myself in the mirror and I said, I'm not happy. I'm burned out. I was probably 39 at the time. I'm 45 now. And I said,
your age at all. I was trying
Oh,
to do the
thanks.
math with how you were an associate for that long. And I was like, this doesn't add up. I couldn't figure out your age. But
Thanks. Actually,
listening, okay, Dr. Eric Black looks far younger than his age. That's all I'm going to say.
so, thank you so much. But actually, that really worked against me when I first got out of school because I was 29, but it looked like I was 15. And I really had to go out of my way to get patients to, that was a lot of imposter syndrome there and false belief. And, I felt like a fraud. And I was talking to these CEOs and these professors and lawyers and doctors. And here I am, this, baby-faced dentist trying to explain treatment. And I just put so much into it. And I would get so upset when someone wouldn't accept treatment from me, or they didn't like me, or if I got a bad review, I would take that all personal. And I started to just replay the day over and over in my head. I couldn't shake the day. I would think about the one bad thing that happened and not the 30 good things that happened. And it affected my sleep. And then I'd look at the schedule the next day and I'd be like, oh, Mrs. Johnson's coming in. And I would be thinking about that all night. So all of these things, and it took years, just bubbled up. And I got to the point where I said, I've got to do something. And at Tulane, I was a psychology major. So I always knew that at one point I wanted to go to therapy, and I just never did it. But I finally picked up the phone and I called a therapist, and I started doing therapy every 2 weeks, and just did a lot of soul searching of why I was the way I was. And one of the biggest keys was I just got comfortable with myself. I realized that I had to take care of me before I could take care of others. And sometimes that meant saying no to others. But when I said no to others, I was saying yes to myself. So that was a major breakthrough for me, was just getting comfy on the inside.
Mm-hmm. So I would imagine you implemented some changes that allowed you at some point to function in a more stress-free way. And from our conversations, I know that it's now a mission for you to help share those changes and that path with other dental professionals, because this isn't just like a Dr. Black problem. This is not even just a dentist problem. This, I think, is appropriate for a lot of people. A lot of people can relate to what you just talked about, carrying their work stress into the evening, into the night, focusing. I know I even have team members who I have to say, listen, 10 great things happened today, at least 10 great things. One challenging thing happened. Don't take home with you that one challenging thing that happened. Like, you have to train yourself to look at things a certain way. You have to really intentionally change your perspective to, be successful in these kind of roles. So tell me a little bit about what you're doing now to help people that may be facing that burnout, and what they can do to kind of learn more about what you're doing.
Yeah. So I just want to get the message out there to dentists, dental professionals, anyone that's going through work-related burnout. It could be in any profession. Actually, I spoke to a veterinarian, a very talented young veterinarian who made a mistake, and it was actually a dental procedure. And the dog that she was working on ended up getting some eye damage, and she just now is like curled up in a little ball in her head, and is just always afraid of getting sued. And it's really just changed her her day-to-day life, just from that one mistake. But the false belief that dentistry is just a stressful profession and there's nothing you can do about it, and it is what it is, and this is the profession I chose. Not true. That's not true at all. You can, and it for me, it took a while. It took a lot of therapy and soul searching and changes at work but I got back to the point where I love going into work every day. So the first step is to take action, to first actually to realize that you're having a problem, then take action on it. And for me, it was therapy, but for the listeners out there, it could be mentors, a coach, a consultant, or just engaging with your peers. But get out there and realize there's a problem, but you got to do something, because these problems aren't going to go away on their own. So I wrote a book, which is going to be coming out in May. It's called The Stress-Free Dentist. So I'm going to try to get the word out there that you don't have to be stressed all day and you don't have to be burned out. You can get past it, because I was there and I did get past it. And I'm also going to be starting my first Get Stress-Free Dentistry Summit, which is going to be a conference focused on just how to get your practice less stressful, more efficient, more productive, and just have fun. It's going to be a networking and fun event. So I'll give you more details on that when I have it.
Awesome. Wonderful. Well, thank you so much, Eric, for being with me today and for sharing this information. I know people are relating to this. If they want to connect with you, you've got 2 Facebook groups. You've got Deals for Dentists, and tell me the name of the other.
The Stress-Free Dentist.
The Stress-Free Dentist. And so I'm sure some of our listeners and friends will join you over there. Thank you so much for being here today. And to our subscribers and our friends and our listeners, thank you for just taking the time to listen to our content. And if ever there's anything I can do to help you grow or improve your practice, you can reach out to me at grace@identitydental.com. And I hope you have a great day.